Coming up, we'll be on location at Grande Dental Care in Herndon, Virginia, discussing advances in dental implants and how they can help restore your dental health and your beautiful smile with one of this region's top dentists, Dr. Marcos Grande. Dr. Grande completed his residency at the Division of Maxillofacial Surgery Department at Jackson Memorial Hospital in Miami, Florida. He is a member of the American Academy of General Dentistry and the American Academy of Dental Sleep Medicine, among other organizations, and Dr. Grande is widely recognized as one of this area's leading dentists. Welcome, Dr. Grande. It's a pleasure having you back on our program.
Thank you, Rocco. It's always a pleasure being here with you.
Thank you. We have a lot more to talk about today. Last time we covered sleep apnea and all the problems related with that and how to correct it and treat it. And today we're here to discuss dental implants. And I wanted to ask you if you can please begin by telling us, for those who may not know, what dental implants are.
Absolutely, Rocco. Well, dental implants is a root-formed titanium piece that's is being used to restore missing teeth. Usually the tendency years ago, when you were missing a tooth, it was to do a bridge that would involve filing down good teeth adjacent to that space and having a 3-unit bridge put in, or more teeth. But in this case, if you were missing one tooth, you would have to file 2 teeth, just to get one replaced. So nowadays, with the advance of dentistry, the dental implants are the best choice as to restore missing teeth, 1, 2, or a full set of teeth. So that's basically what a dental implant is. It's a root-formed titanium piece that goes inside, is surgically placed inside the bone. You let it heal for 4 to 6 months, depending if it's on the upper jaw, lower jaw, and then you restore the implant with a crown.
And what types of problems do dental implants address, besides a missing tooth?
Bone reabsorption is one of those, and that's very important because usually when you lose teeth, if you don't have anything inside the bone stimulating the bone, have you ever heard, if you don't use it, you lose it?
Yes.
Exactly happen. If you're not stimulating, that bone inside the bone with the root of a tooth, okay, it starts shrinking. Shrinking and shrinking. So you're losing width and height of that bone. Imagine a patient that has no teeth and just wants a denture. Well, those patients, that intermittent flapping around the tissue can cause an overall bone loss, and eventually they lose most of the bone, to the point sometimes there is no more bone just to place implants and restore the patient. So if you lose a tooth, a few teeth, or all your teeth, usually if you can, it would be better just to consider dental implant restoration, because with dental implants you can just put a crown or do implant over dentures. You can do several treatments. Now is the standard of care, in my opinion. Even for dentures, I would recommend my patients at least to get 2 implants on the bottom, just to mechanically retain that denture so it's not flopping around. They're going to be able to eat more comfortable. They feel more secure. The confidence goes to the roof. I remember one of my patients that I've been interviewed, she couldn't buy an apple with that old, denture that she had. We placed 6 implants on her, and we deliver an implant retain denture over 6 implants. And now she's happy to tell me that she's biting on an apple. We were able to free up all the palate. She's tasting the food. She's a happy camper.
That's great. Where before she couldn't do that or had a big problem doing that.
People with denture can't do that, unfortunately.
Now, are there different types of dental implants that are available, doctor?
Industrial are basically the gold standard. There used to be the blade implant years when everything started, but those type of implants are not longer used anymore. So it's basically they have standardized the implant systems.
And I understand there's some advances in technology recently that has taken place that allows the placement of dental implants to be done in a more efficient manner.
That's the exciting part of the profession, that everything evolves. And if you want to be on the top notch on what you're doing, you need to stick to the advancement in technology and go with the times. We use here a special software where we upload our CT scan, which is a 3-dimensional views over the patient's bone, and we can virtually plan the implants and see exactly where we can map the nerve, the maxillary sinus, make sure that we're not hitting any important, nerve or anatomical structure. So we plan everything, and once everything's planned on the software virtually, we push a button and we send to a special lab that fabricates surgical index or surgical guides that basically have all that information in the guide, whether to put one implant or to put 6 or 7. And the beauty of that is, since everything has been planned ahead, I don't have to cut open a flap, and detach the tissue. So it makes the whole thing much easier and predictable and much comfortable for the patient. I have patients that have, on average, we place 2 or 3 implants on a patient probably in 40 minutes.
That's great.
Whereas before, you would have to cut open a flap, see where the bone is, watch the x-ray, kind of guide yourself through the adjacent teeth. It was kind of more complicated. Because of that, chances for failure were higher in the past.
Yeah.
I've been placing implants with this system over 2 years ago, and I'm telling you, the rate of success is way up. I would say 95%.
That's wonderful, Doctor. That's great to hear. It's taking it to another level as far as saving the patient's time, taking the guesswork out, a lot higher level of success, as you mentioned, to get the results folks are looking for. Now, I know this varies, I'm sure, based on each patient, but how long would typically the process take from start to finish? Are we looking at 8 months, 12 months?
Yeah, basically, it could be somewhere from 6 to 8 months.
Oh, okay.
More or less. Yeah, because once you place the implant, you need to let the bone integrate into around the titanium of the implant. Yeah. And that usually takes 4 months for the lower jaw, 6 months for the upper jaw. Okay. And then after that, you can load the implant and then restore it. So because of the healing process, it's what makes the process a little longer. And it might take, as I said, 6 to 8 months just to complete a case.
And if somebody's missing like 1 or 2 teeth, and they come to you and you basically come to the conclusion with the patient that a couple of dental implants would be the best option, would they be able to have those missing teeth filled immediately in some temporary capacity while you're going through the implant process, or are they still looking at missing teeth for a while until the implant?
No, you have the option. Usually, the reality what happens with my patient is if it's a molar or teeth in the back where there's not visible, patients really don't care much about getting a temporary over the implant. When we have an anterior situation where the aesthetic is compromised, we can just, put a temporary crown on top of that implant that was immediately placed. We just place the implant and immediately load it with a temporary crown. Absolutely, we won't let our patients walk away without teeth at any time.
That's certainly good to know. Yeah. And what would you say, Dr. Grande, are some of the benefits of dental implants over, say, dentures, for example?
Well, there's a big difference and big advantages of having implants when you're getting dentures, or what we call implant over denture versus a denture. Implant over denture first is a smaller piece of prosthesis, all right, that you don't need a palate. Usually the retention, it's great, it's pretty stable, it's much more stronger, it doesn't break. It maintains the bone of the patient, because remember what we mentioned before, having something inside your bone is going to stimulate that, so the bone cannot recede or resorb any further from that point where you have the implant placed. So you're going to we're going to be able to manage to maintain the bone of the patient. Whereas with dentures, that constant intermittent, the denture moves, is a bigger piece of prosthesis. It covers the palate. People cannot taste the food. That flipping around and that intermittent flapping and hitting the bone cause resorption or losing the bone over time. So that's why patients with just dentures, after 5-6 years, they say, "Oh, my denture's kind of rocking now. It's moving. I can eat." And those are the major big differences. It's just a different world.
It is.
From dentures to what we can, offer the patients nowadays.
Yes. And what type of results can we expect from dental implant restoration?
Well, again, you're saving tooth structure. You get more durable results. The long-term prognosis is a whole lot much better, and it looks great like natural teeth, and it feels like natural teeth.
Yes. We're now going to meet some patients of Dr. Grande. Welcome, Dan. It's a pleasure having you on our program.
Glad to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Dan, by asking you if you can please tell us what problem or problems were you experiencing that brought you to Dr. Grande and Grande Dental Care?
I had an infection in one of my bottom teeth, and came in, had it looked at.
So then what happened after that?
It was an old root canal that I had had many years ago where the tooth was rotting from the inside out. So what we needed to do is we needed to pull that tooth and then put 2 implants in.
So can you please tell us about the process that you went through regarding having the implants put in?
It's about a year-long process. I think there was 3 or 4 visits involved. The first visit, they actually pulled the tooth out and then come back about 3 weeks later once it's healed, and then they put some kind of filler in to fill the hole. Then that takes about 4 months for that to grow. Once that's grown and becomes solid, they go ahead and put in, it's almost they drill and put like a helicoil into your tooth. Oh. Okay, then once that heals, that takes about another 4 to 5 months to heal. And then what they do is they actually take the tooth and screw it straight down into your mouth, so they sit right next to each other. And he has some device where he measures it all out and gets it exact. And then I also had porcelain teeth put in.
Oh, veneers.
Exactly. So while we were going through that year-long process of waiting for the implants to get done, we did the veneers.
Oh, very nice. And how do you like the results, Dan?
I love them. It was great. It's and my wife loves it. It's really good.
And lastly, before I let you go, Dan, for all the folks out there watching, what would you tell them about your experience not only with Dr. Grande, but his staff here at Grande Dental Care?
Oh, excellent, excellent. It's painless. Everything I did with all the procedures I had done was 100% painless. Comfort factor walking in the door, it's a family business. I feel like I'm going to a family business.
Oh, that's wonderful. And on that note, I'd like to thank you, Dan, for joining us, sharing some of your experiences, and being a guest on our program.
You're welcome.
Welcome, Cecilia. It's great having you on our program as well.
Thank you very much. I'm pleased to be here.
I wanted to begin by asking you, Cecilia, what brought you to Dr. Grande?
He was the dentist, first of all, and I was very much in need of one. My husband and I were living in Florida, and we moved here to Virginia because of family. And I needed a new dentist, so somebody recommended this office, Dr. Grande. And when I came here, I liked him very much, so I stayed here as his patient.
Oh, and can you tell us about some of the treatment or treatments you've had done here?
I am diabetic, and my gums are very sensitive. So they already have told me in Florida that I needed implants. So I was a little afraid to find a dentist because I came from another dentist, from across the state. So, but Dr. Grande said he could do it. So he gave me some implants, and he finished the work with the dentures, and I have everything done perfect. I have it finished perfectly. And I told him that now that it's finished, I'm going to miss coming here.
Oh, you like them that much?
Yes.
They're like family now
it's
for
like
you.
Family now, yes. But I like it because he was very precise. When he needed something, he said to me, no, we're going to redo it. Yes, I don't like that. We're going to see it again. So he was very, very careful and very precise in his job.
Oh.
Yeah.
Oh, so you're very pleased with the results?
I am very pleased with the results.
And what would you tell all the folks out there watching about the whole staff here?
It's great. They are very friendly, very nice. I went to other dentists before I came here, and it was so impersonal. I went there, and the telephone was answered by a machine. I couldn't get an appointment. I went over there, but there were so many people around that I felt like nobody had listened to me. So when I came here, it's friendly. the secretaries were very nice. Dr. Grande was very interested in what I have to do, and he said, yes, I will do it, what I can do.
I'm so happy to hear that. Obviously, you're ecstatic and very pleased with the results.
I am very pleased with
and
the results.
you obviously love everything that's taken place.
Everything. I really enjoyed coming here. Right now, he's not only my dentist, he's my friend.
Oh, well, on that note, I'd like to thank you, Cecilia, for sharing your experiences with us and being a guest on our program.
You're very welcome.
Larry, it's great having you with us.
No,
Thanks
thank
for
you.
coming down.
Thank you very much.
Now, I wanted to begin by asking you, Larry, if you can tell us what dental problem or problems were you experiencing that brought you to Dr. Grande?
Age. More than anything else, I was at a point where I had some crowns that were rather old, and so they were decaying underneath. And so when Dr. Grande looked into my mouth, I'm sure that he thought it was part of the Mayan ruins. But it turned out to be that there really was a plan to help. And it ended up by being a couple of implants, and we're working on that progress right now. And there was also part of the plan, he saved a couple of the other teeth so that we didn't have to go through, the implant period at all. So that I appreciate.
Oh, yes, indeed. So you kept a few that you thought you might lose, on top of adding some dental implants. And how far in the process are you, Larry?
Well, I'm about halfway through from an implant standpoint, where we've already got the bone built up and such, and all I have to do is put in the posts, and then the implant, which is probably going to take about 6 months.
Okay, and then you're done.
And then I'm done.
New set of teeth to go with the ones you already have, right?
Yeah, well, I'll outlive George Washington.
There you go. Now, can you tell the folks how your process and experience has been here?
Well, it's been one of when I came in, I needed a plan, but I didn't know that he was going to give me a plan. But I was in pain, to be quite frank with you. And I think, of course, it's all more than one person, but I think the entire staff here, has done a great job in being able to pull together and to make me feel like, okay, now the next step of your plan is, and then we go from there. So it's been pretty straightforward, like they care.
That's wonderful, and obviously you seem very happy with the results thus far.
So far, and I really, the hard part is over, to be quite frank with you.
Yeah.
But I think there's still more, to come in the cosmetic area. But I'm in the public quite a bit, and it's just something that I would prefer, to have the best foot forward.
Yes, indeed.
And that I think Dr. Grande understands clearly, and so we're kind of working together there.
Working like a partnership, right? Mm-hmm. To get the results that you want.
Right.
And lastly, before we let you go, for all the folks watching, Larry, would you recommend Dr. Grande and his staff here at Grande Dental Care?
Oh, absolutely. In fact, I'm not going to let anything out of the bag, but I'm going to be working at another location, to see if they need dental care, on a patient basis. So he can run by maybe 1 or 2 days a week, to do that, and it's a residential facility.
Oh,
okay, long-term care.
Obviously, you're that pleased with him, where you're recommending him to a number of other folks.
Right.
Well, that's great, Larry. And on that note, I'd like to thank you for sharing your experience and being a guest on our program.
Well, thank you for asking. I appreciate it.
Welcome, Christine. It's wonderful having you on our program today.
Thank you. It's nice to be here.
Now, I wanted to ask you, Christine, what I asked the other folks a few moments ago, and that is, what problem or problems were you experiencing that brought you to Dr. Grande?
There was actual multiple problems. When I was a kid, I ended up knocking out a permanent tooth. Throughout my life, put off the root canals, never got anything done. Was diagnosed with type 2 diabetes, and they were telling me, you need to go see a dentist. So I went to the dentist, and he told me basically what every other dentist told me, you have to have that tooth pulled. Mm-hmm. Being that it was right up front, I mean, it's the main tooth everybody looks at.
Sure.
It's a little nerve-wracking, and
yes.
So I decided to, okay, well, now's as good a time as any. Let's pull it and go whichever way he suggested that I go.
So what happened then? So you got the courage and the nerve to have it done
Yes.
for the reasons you just mentioned.
Yes.
It's right in the
It's
front.
right in the
It's
front,
when
yes.
everyone would notice.
Right.
So then it was you came here, Dr. Grande obviously removed that tooth.
Yes.
And then what took place to cover it, because you look like you have a wonderful smile now.
Yes, he actually gave me the choice. He gave me two choices. I could bridge it or implant, and being that it was right up front, I figured let's go implant because it's more natural. I didn't want to destroy any other teeth because
Sure.
they're strong.
Yes.
And that's the route we took, was the implant.
That's great. You probably had a temporary crown put in initially to cover
I
the
did.
missing tooth, so
I
no one
did.
saw it missing after it was
No one
pulled,
saw it, yes.
while the implant was going through its process.
Yes, it was definitely a learning experience to have, that tooth extracted, and then
Yes.
we had a mouthpiece in, and then once we got the post and threw the work in, and he put a temporary in for me, so it was, yeah.
And how do you like the results now?
Oh, I love it. Love it.
That's
I can't
great.
say anything more. It's great. I love it.
That's wonderful. And before we let you go, Christine, for the folks watching, what would you tell them not only about your experience with Dr. Grande, because obviously you seem very happy, but
Yes.
the staff here.
The staff here is great. They're always warm and welcoming. I have a little anxiety when it comes to the dentist, but they were, breathe, take it easy, it's going to be okay. And as he's doing the work, he tells me step by step what he's doing, and he's like, any issues, just raise your hand, we'll stop, we'll do whatever you need. So
And I understand from the other folks I've talked to today, they really treat you like family here.
yes,
On that note, I'd like to thank you, Christine, for joining us and being a guest as well.
thank you.
It's our pleasure. You and your practice, Grande Dental Care, have certainly established a reputation for excellence here, not only in the Herndon, Virginia area, but you have patients from throughout the region that come to you, Doctor. I just wanted to ask you, what would you say helps separate you and your practice from the others?
Well, basically, it's the convenience for the patient that they can come and get all the dental work they need in one office with the same doctor in a few appointments.
Because you offer a lot of different treatments, implants, obviously sleep apnea, porcelain veneers, whitening, general dentistry, endodontics.
Root canals, everything. So
Yes.
you don't have to be, driving around town just looking for a specialist to get a root canal and the other one to get the teeth pulled or get in an implant. You get it all done in the same office.
Yes, indeed. And on that note, I'd like to thank you, Dr. Grande, for joining us again, being a guest on our program. It was our pleasure having you.
Thank you so much.